Hey guys, this is Victor, and today I'm here with Dr. Marmanillo from the Middletown Health and Wellness Center, and he's got this really cool device, this soft wave device that uses ultrasound for pain relief and more. How you doing?
Hey, how you
How's it
doing,
going?
Victor? It's good
Great
to
to
talk to you.
yeah, same here. Great to see you again.
Yeah, you
Um,
too.
so hopefully this is going to be just the first of many videos.
Absolutely.
Right. So tell me a little bit about this soft wave. I was calling it shockwave before, the soft wave device, soft wave therapy.
Yeah,
Mhm.
it's kind of like a new technology. It was developed, I think it was actually discovered in Israel, developed in Germany, and they've been using it in Europe for a while. And so now it's come to the United States. It's beginning to gain popularity. Um, Back in the days, I guess to break up kidney stones, they use ultrasound through
Right.
shocks, and then they some doctors must have seen that, hey, we could use this for other purposes. So they kind of like revamped that machine to treat other conditions. So musculoskeletal conditions is one of the things that it treats now.
Mm.
So they tweak the machine. It still works the same way. The shocks create a spark. Spark creates a supersonic sound wave, penetrates deep into the tissue to where you have inflammation, whether it's a tear, arthritis, whatever the
Mm.
case, right? Any kind of injury.
So not only on joints. It's
Um,
not just like knees and elbows, but even other areas of the body.
yeah, well, because we're a chiropractic office, we have to kind of stick to our, scope of practice. So we
Hmm.
can only do musculoskeletal conditions. But
Gotcha.
yeah, I mean, other variations are used in wound care. So maybe like
Oh,
surgery
okay.
to speed up the wound healing. Uh, Who else? Urologists use it in their offices for
For the
erectile
stones.
dysfunction. No,
Okay.
no, erectile dysfunction. It helps with that
Oh, right, right.
because
Uh-huh.
it strengthens the blood vessels and
Yeah.
increase blood flow. Right, it brings more blood flow
Right.
to the area when you're stimulating
Hmm.
that knee. Let's say it's that bad knee with the shocks. And each treatment is 500 impulses. Boom, boom, boom. The the body's immune system responds, so it brings in more blood flow to the area, and then all the nutrients run through our blood, right?
Right, right.
More blood flow to the area means increased healing. And it's also nicknamed the stem cell machine because it's been shown, there's a lot of studies you can look up to stimulate your own body stem cells, which is excellent because as your old cells die off, your body can create new ones.
Yes,
Now, this
nice.
takes time. It's not going to be a one time thing. But the cool thing about it is the patients see results right away as far as inflammation, maybe increased range of motion, right? Because let's say you hurt your knee, you have extra fluid in the area, and you lose your range of motion because of that. So just with one treatment, most of the time, a lot of patients can tell right away
Oh,
that if it's going to work or not.
oh, that's really nice. They'll get at
Right.
least a hint
Exactly.
if it suits them.
Right. So
That's pretty cool.
they'll have decreased pain, decreased swelling, increase of range of motion right away. But over time, then you have the creation of new blood vessels, process called angiogenesis, right?
Uh-huh.
Angiogenesis, creation of new blood vessels, and then the stimulation of your own stem cells. And that happens over time. So usually what studies show, like about 8 to 10 treatments is kind of like the sweet spot to get all
That
that going.
that's pretty quick. And how long do they have to wait before each treatment?
So initially, just to stimulate the body's healing response, we do it 2 times a week for two
Okay.
weeks. Right? This is all based on studies, right? When no one just made it up.
Right, okay.
This is what shows to get the best results. Everybody wants the best results, the quickest results. 2 times a week for 2 weeks. That gets the stimulating going on, the body's immune system to know that there's something going on. It needs to go in there and repair. Once you get that going, then for the next 6 weeks, it's just 1 time a week because the
Oh,
body actually heals at rest, right? Let's say
uh-huh.
you're gonna join a gym and you want to bulk up, you want to gain some muscle mass.
Right.
you're training with weights, whatever you're doing, you're actually breaking muscle tissue, right? You're actually
Yeah.
tearing your own muscle fibers. Now the body says, "Hey, something's going on here. The muscle fibers are torn. I need to rebuild it and make it stronger for the next time," right? So with each
Right.
workout that you do, the body repairs it and makes it stronger for the next workout, and that's how you get hypertrophy, right? The big muscles, and that happens over time. But the body that hypertrophy and repair happens when you actually rest, not when you're in the gym. In the gym, you tearing up
Right.
the cells, right? The fibers, and then when you're sleeping, hopefully you don't have amnesia. But I mean not amnesia. You know what I mean?
Man, now I just forgot the word too.
Yeah,
Insomnia.
insomnia. Yes,
Insomnia.
I knew it was fibers.
Yeah.
So it's hope if you don't have insomnia, you can sleep well, and you eat properly. Some people take supplements if they're deficient in certain supplements, certain vitamins, minerals.
Mm,
Then that's when the body heals. So we have to give the body time to heal. So at the
right.
office, we stimulate 500 impulses to the area, and then you rest for a whole week, and that's when your body heals.
Nice.
In the following week, and we do that for 6 weeks. The whole program is 8 weeks, and then you take 2 weeks off to see how the body's because your body, even though we finish the treatment for the next 2 3 days, maybe another week or two, your body still the healing's still going on, right?
Right, right.
And then the patient will come back, and then we do another consult. Now, if let's say it's a fresh injury, like I have somebody who really likes to go to the gym, and they just recently just hurt their shoulder, they can't lift anymore. It's a new fresh injury. So we do a session with them. They might even be healed before they finish their 10
Oh,
days,
right. Okay.
right? Because they're young, they're
Everybody's
strong.
different.
Exactly.
Yeah.
And they could be pretty good. Next consultation, they're like, all right, Jane, it was great meeting you. I'll see you next time you get hurt. Whatever.
Right.
Or you can have a senior citizen who's had, let's say, knee pain for 20 years,
Mm,
lost all their cartilage. Now their joints are actually bone on bone. That's severe, severe pain. They already did physical therapy. They tried,
yeah.
pain management. They did the injections. They tried the plasma injections that try to rebuild your own, stem cells, whatever the case. And their only option is surgery. And they don't really want to get surgery.
Mm,
They're looking for something else that will give them pain relief to be able to do their activities of daily living, right? That's what
right.
life is about. It's about doing the things you love. But they're used to functioning at an 8 to 10 pain level where they can't do anything. And after a while, that's depressing, right? It affects their emotions.
Yeah.
And so if we can help those type of people, obviously we're not going to cure a 20,
Right.
30-year-old knee with no cartilage, right? There's no
Right.
amount of repair that the body can do at that point. But if we could take them from an 8, 9, 10 pain level down to a 3, 4, now that's more manageable.
Wow.
Walk around with pain with 3, right? All of us have aches. I mean, I have ache right now, right? But if we could get them down to 3, 4, now they could go on their walks, right? After dinner, they could go on their walks.
Right.
They could start an exercise program. They could try to lose weight because a lot of people can't go to the doctor says, all right, you know, you're 30 pounds overweight. That's why you have so much pain and pressure on your knees, and your knees can't take it. You need to work out. Lose 20 pounds. But how am I going to do that if I can't even walk?
Right. Right. You got kind of a chicken and
Now,
egg problem going on there.
exactly.
Yeah.
So if there were, and if from a therapist's point of view, I would tell those patients, hey, go join a gym because then you know you're not going to have the weight of gravity on you. You can
Right.
walk or exercise in the water.
And
But with
so
the
the
software,
ther
mhm,
so the soft wave can reduce the pain so that they're able to do
right?
some
So
more
with the soft
exercise.
wave,
Yeah.
if we can get them, like I said, from an 8, 9, 10 pain level down to a 3, 4, now they could go to the gym. Now they can start walking. Now they can start their weight loss journey.
Nice.
Then it all builds up, and now it gives them the boost, gives them the confidence back, gives them hope, right? Hope
Yeah. Oh,
that
man,
there is help out there,
yeah.
right? because everyone told them, that's it. Nothing else we could do.
Mm,
You have to live on narcotics. And a lot of people don't really like taking pain medication.
right.
So many people come through, they're like, "Oh, I hate pain meds. I don't even want to take them. They cause ulcers." I mean, just look at the side
Uh,
effects
there's
of
so many.
pain
Yeah.
meds. I mean,
Yep.
even just over the counter stuff, right?
Yep.
Tylenol, ibuprofen. Just go read the side effects. See all the stuff that it could give you.
Right.
So, those type of patients can play with the grandchildren again. It gives them really great satisfaction. So, at the end of that 10 treatment period, we give them 2 weeks off and to see how their body responds. Now, when they come back, if they need another further care, then we offer more plans, more programs for them to be on. But eventually,
Okay.
those type of people, we get them on a maintenance plan. Okay,
Right.
our
Right.
own doctor,
For the
Doctor,
elderly.
exactly, he's on a maintenance plan because his knee, he's bone on bone, and he wasn't able to continue working. He was like, "I'm gonna have to retire early. I can't do this chiropractic
Mm.
work anymore." But he treated
Uh,
his knee with the machine, and now he's like on once a month. So we have patients that come once a month.
Only once a month, huh? And
Yeah,
wow, that's
and
pretty
that keeps
awesome.
them, keeps them
Wow.
surgery free, and
Okay.
that's their
That's
goal.
pretty amazing. Yeah. That makes it
Yeah,
extremely cost effective too.
oh, absolutely.
Yeah. I love devices, man. Devices are great.
Yeah.
Mm. So, very, very good. I should have mentioned that in my old video on ultrasound. I should have mentioned the Softwave device.
Mhm. Oh,
Um, that I might have to do another video and mention that. But yeah, it's
it's
I mean,
similar.
like,
It's similar to ultrasound. We actually
right.
use ultrasound gel, and we warm our
Oh,
gel.
right. Okay. Nice.
Our gel is warm, so everybody's surprised when we first apply the gel to the area. They're like, "Oh, I didn't jump. It's nice and warm." You're like, "Yeah,"
Nice. Nice.
and that helps the applicator, get the sound waves in.
Nice. Cool. Yeah, very good. Yeah, well, I'll show people. I'll point people to some other videos about it and some other information.
Mhm.
I'll insert some pictures of the device, and of course, they should just come to your office in Middletown,
Yeah.
Health and Wellness Center, and come get some sessions done and check it out. Now, do
Mhm.
you? So, I mean, people of every age. Like, what are the youngest people that come in? Like, do you see like college or high
So
school like
we also
athletes?
have high school students.
Okay,
Okay.
I guess
Um,
kids that get injured in sports and stuff.
yeah, there's a
Okay.
lot of kids who really love sports and they're like playing year round, right? They're like on
Right.
travel teams, so they're constantly playing, constantly whatever. Let's say it's
Oh,
softball, right? They're constantly using their shoulder, damaging it, damaging it. And they don't really
gotcha.
rest it. So they come, and we decrease their pain, and they could go, throw the
Cool.
baseball,
Nice.
and I have actually a swimmer. He's actually gonna go to college for swimming scholarship. Now, young
Oh,
too, high
wow.
school student, right? High school kid.
Wow.
So when he meets, practices, starts getting the shoulder pain, come in, do the treatment whenever it acts up. Like with them, it's not like treating like an injury, a fresh
Uh,
injury like the older population, right? They're young, so their body's always healing. Like kids, man, they bounce right back up.
right, right.
So they
So
just need
one
something.
treatment has a big impact on them, I
Oh
guess.
yeah.
Yeah.
So they'll come back. So for them, there's no regimen. They just come back. Let's say they had like fight like a meet, right?
Right.
Or like a tournament, and then so they overuse their knee, whatever, shoulder.
Mm. Right.
So they'll come in after that. So I might not see them maybe for 3 weeks, 2 weeks, a month, depending.
Gotcha.
Yeah.
Okay. I should mention too, just for people that are watching, the device we're talking about is not something that we can really purchase for home. It's a really high-end device. It requires special
Mhm.
maintenance and care, so it's a very expensive device. So it's something that you have to go to a doctor's office for to receive treatments from. Because I do a lot of device videos, but this is yeah, pretty cool device, and you have one in your office, so that's awesome. Yeah,
Yeah, we have one. Yeah, one of the
yeah,
first people around here. in Orange County to actually get one.
Oh, wow.
Mhm.
Wow. Well, yeah, you mentioned earlier too that it has a history in Germany, so it came from Europe, this
Mhm.
device originally. That's
Yeah.
cool. Yeah, the Germans and the Japanese tend to know what they're doing, man.
Yeah. It seems like Europe always has, like, the latest technologies first when it comes to healthcare or other things, and then it slowly comes into the United States.
Right. We seem to have a lot of bad technology in the US though
Yeah.
too. But I think they're a little bit stricter actually in Europe. I think, you've got all the different competition between the different countries over there.
Mhm.
And the Germans are just, yeah,
Mhm.
they're always on like the bleeding edge. But it's good to know that, like I always tell, I don't like to use things that are on the bleeding edge. So it's
Mhm.
nice to know that this already has a well-established history. It already has a very good track record. So it's been proven
Mhm.
for a long time. It's just extremely new in the US.
Yeah, it's FDA approved, and a lot of sports, teams are starting to recognize it and use it too.
Cool.
You'll see may in 10 years from now, everybody's gonna have it. All the
Oh, I
sports
can
teams.
imagine. Yeah.
Yeah.
Yeah. Yeah, it's cool. Yeah, I talk about these kinds of issues in one of my videos when I talk about ultrasound devices. It's just about you got to be careful because there's new stuff coming, but you don't want to be on the bleeding edge. Make sure it's a proven
Mhm.
safe device. So here we are. Yeah,
Mhm.
there you go. Awesome. Well, I'm looking forward to talking about lots more stuff since looks like we're going to be collaborating and doing some things together.
Oh, yeah, we've got
Um,
some exciting stuff coming up.
Yeah, it's going to be fun. So, anybody looking for me, they'll be able to find me also working with Dr. Marmanillo in his office over there in Middletown. So, go check him out. He's an excellent chiropractor, and he's got this really cool Softwave device. And I guess that's it for now. But yeah, we'll be doing more
Right.
videos. Yeah, man. Thanks. Always great speaking to you, man.
You too, Victor.
All right.
Always great.
Thanks.
Thank you.